question always comes up, should I get a tummy tuck or should I get liposuction? They're different procedures. Liposuction is great for those people who want to lose some inches, but the skin elasticity is good. It's not as good for those people who have had children where the belly is stretched out a lot or have had massive weight loss. And so we have to really examine the patient to see what's best, whether it's that liposuction procedure or whether it's a tummy tuck. By the way, a tummy tuck also tightens up the abdominal wall muscles and removes all that extra skin and fat. I think of a tummy tuck like pulling down a window shade, pulling down that extra skin to remove it, at the same time tightening those abdominal wall muscles to pull the whole belly wall in and make it as tight as possible. At the same time as a tummy tuck, I tend to contour the sides as much as safe. And some people want to have other procedures done, like liposuction of the legs and things like that. So the other question that came up a little bit earlier is, can we combine procedures? And yeah, I do mommy makeovers where we combine breasts and belly. So what does that mean? Because it's a little bit confusing. When you do like either a tummy tuck or liposuction, we can do a breast, either reduction, lift, augmentation, depending upon what the person wants. So combining these procedures is absolutely fine, as long as it's safe and the patient doesn't have a lot of medical problems. Combining them is really easy to do. Modern mommy makeover includes things like doing vaginal rejuvenation, labiaplasty, and things at the same time. So we often will combine those. All right, let's head over to breast, because a question came in earlier today about breast reduction versus breast lift. Breast reduction is a great procedure for those patients who have had large breasts, neck pain, back pain. Patients have so many symptoms with large breasts. So we do what's called a breast reduction, which allows us to lift up the breasts at the same time. So yes, for those asking, lifts are included in reductions. It's the same procedure. We lift you up and we remove some extra tissue to make you smaller, more perky, put the nipples back where they're supposed to be. That alleviates most of the symptoms in patients with big breasts. So whether you're born that way or you got bigger breasts as you age, or with weight fluctuations, things like that, we can lift up the breast or we can lift and reduce it. For those patients who want an implant, we either put an implant in or we can put an implant in and lift you. So tons of different things that we can do to make the breast look better. Most of these patients are ambulatory, meaning you go home right away after the procedure with not a lot of downtime. So that comes to the next question that somebody just asked is, what is the downtime for a tummy tuck and what is the downtime for a breast procedure? Breast procedures, a day or two. With our Greenberg rapid recovery programs that myself, Dr. Weiss, Dr. Ross, Dr. Cooper all do, we can get patients back to work very, very quickly, and that's a day or two. Now, that doesn't include working out or heavy lifting, but if you're at a desk job where you're not running around all day long and lifting heavy objects, usually after a breast procedure, you're back to those activities in just a day or two. Tummy tucks are a little different. Tummy tucks, we tend to keep patients out of work or heavy physical activity for about 7-8 days, something like that. So that's the difference between tummy tuck. Liposuction, downtime, a day or two. Liposuction, I think of as like taking the air out of a balloon. All right, just want to answer another question. It's about eyelid surgery. The extra eyelid skin we remove when we do the eyelid lift. If you have fat puffiness or extra skin in the lower lids, we can get rid of that by doing a lower eyelid lift. And often we'll combine those procedures with a light laser peel or a chemical peel to help reduce the wrinkles, the fine lines, and to make the texture and tone of the skin better.
How do I know when it's time for a facelift?
That's a very common question. Are we ready for a facelift or are we not? And facelifts take care of different anatomical problems. So if you have jowls, if you have all that extra skin in the neck, those, or if the mid faces come down, we can take care of that with a facelift. I do all different types of facelifts depending upon the person, and individualizing this is super important to me. And we're doing facelifts younger and younger. So it's not an age determination when you're ready for a facelift, but more it's an anatomy determination. It's what you look like. Do you have the jowls? Has the mid face come down? Do you have extra skin and fat in the neck? And if those things exist, then we'd go ahead and do some sort of neck lift or a facelift procedure.
What are the benefits of CO2 laser?
Love CO2 laser. So resurfaces the skin, gets rid of fine lines and wrinkles, gets rid of bad texture, acne scarring. It even tightens up the skin with CO2 lasers. So we do a lot of CO2 lasers either by themselves or with our facelift procedures.
How long before surgery do you have to stop smoking?
It depends upon the procedure. You know, I tell everyone 4 to 6 weeks is my goal. Certainly certain patients can't stop smoking. So, you know, we warn them that the healing may not be as good. I prefer that someone stops. The longer, the better.
What is the downtime for CO2 laser?
Downtime for CO2 laser is about a week. After a week, you're going to be mostly red. That redness goes away over time. And I tell you, put sunblock on, you know, pretty consistently for about 6 months or so.
How long after surgery do you need to do lymphatic massages?
Lymphatic massages depends upon the procedure and depends upon the patient. So sometimes we don't need any lymphatic massages, but in liposuction patients and in tummy tuck patients, often we will ask the patient to get lymphatic massage. Often lymphatic massage can help in a certain patient.
When is a good time to do CO2 laser?
CO2 laser is variable. Sometimes it's in the teenagers with acne, and sometimes it's in the 90-year-olds who want to get rid of fine lines and wrinkles. If you guys want to come down and see me or any of my associates, we're happy to see you at any of the Greenberg Cosmetic Surgery and Dermatology offices. DM us or give us a call. We'll go to greenbergcosmeticsurgery.com. Thanks for tuning in, and we'll see you soon, guys.